the continents of Africa, Europe, and Asia meet lies an area of critical importance. Today, the entire Near East is in transition. Ancient lands are stirring with new ideas. Ancient peoples are looking to their future. This is a report on how the people of 3 of these countries, Egypt, Jordan, and Iran, are working with American help to shape this future. Egypt is a desert bisected by a river. Without the Nile, there could be no life. Along the upper Nile, one of man's first great civilizations arose. The ruins of Thebes and Karnak can still be seen, the temples and monuments of the kings who ruled Egypt in antiquity. Today, Egypt is entering another age of progress. Rich in resources that have long been untapped, Egypt is beginning to learn the skills and techniques of the machine era. A few modern plants already exist, but to meet the industrial needs of its large population, Egypt is encouraging the investment of outside capital. Although industry is important to the nation's future, it is in the rural districts that Egypt is concentrating its efforts to improve the life of the people. For centuries, the farmers and villagers have carried the burden of poverty, ignorance, and disease. Today, village centers are being built to help them. These centers are sponsored and staffed by the Egyptian government, but some American advisors are present to assist in the health and education programs. Working side by side, Americans and Egyptians are training young nurses in modern methods of treatment and sanitation. They, in turn, pass on their knowledge to the village women. Hospital facilities, although limited, are also a part of the center. The high rate of infant mortality is being reduced by the most elementary hygienic measures. Preventive medicine is a revolutionary concept in this area. With equipment and drugs, supplied in part from the United States, Egyptian doctors are immunizing against widespread diseases, such as smallpox and typhoid. The Near East has only enough doctors and nurses for a fraction of the population. Midwives are still in common demand. The village center ingeniously turns the midwives to good purpose, teaching them cleanliness and giving them kits of basic medical supplies. Gradually, more and more trained nurses are visiting peasant women in their homes. Here, poverty and disease take their roots, and the first step forward must be one of education. The people have responded quickly to the health program. They bring their children to the eye clinic, where terramycin from the United States is used to treat cases of trachoma. The village center also provides veterinary services, such as a bottle of castor oil for an ailing camel. Throughout the country, American and Egyptian farming experts are cooperating on many different projects to raise the level of agriculture. They are also working to improve native animal and poultry stocks. The village centers are doing what they can to build a healthy, educated youth. But the problems facing Egypt are enormous. The facilities and know-how limited. Simple as they are, these village centers have drawn the attention of the entire Near East, for they mark a significant break with the past that offered little hope and opportunity. Today, a people long held back are trying to help themselves to a better way of life. The aim of American assistance is to show them how to do it. Out on the western desert, a reclamation project is underway to develop new lands for livestock production. American technicians are teaching range management and the principles of water spreading. Behind long level dikes that hold the rain from running off, the ground is furrowed and planted with grass seed. With the introduction of simple conservation methods, large areas of the desert are being brought to life again. Americans are also teaching the principles of crop dusting, using helicopters which were purchased by the Egyptian government. Elsewhere, Egyptians and Americans are working to reclaim new lands and create new farms for thousands of families. Crop dusting is but one effort to increase the agricultural production in this crowded land. The problems of Egypt have been compounded for centuries. There will be no quick or easy solutions. But the people of Egypt are eager to learn and willing to work. Already the shape of a brighter, more productive future is casting its shadow over an ancient land. Jerusalem, divided between Israel and Jordan, is a holy city for Muslims, Jews, and Christians. It contains the Mosque of Omar and synagogues of early Judaism. Nearby are many landmarks sacred to Christians, such as the Mount of Olives, the Garden of Gethsemane, the supposed site of the house of Mary and Martha, the Church of the Nativity in Bethlehem. Jordan is another country awakening to its potentials. Here too, Point 4 is cooperating with Jordan's own program of modernization. A joint undertaking is the National Central Health Laboratory in Amman. The United States is advising and contributing equipment, but the actual work is being done by Jordanians. When the laboratory is completed, Jordan will for the first time be properly equipped to make serums, vaccines, and scientific tests, such as tests of water samples. The shortage of pure water is the cause of many Near Eastern problems. But some new wells are being driven by teams of local workmen trained to operate rigs for power drilling. As in Egypt, water spreading dikes are being built in Jordan's desert. When the project began, many natives of the region were frankly skeptical of its outcome. For to them, only a miracle could make grass grow in what had always been a wasteland. But the miracle worked, and grass has taken root. Even the skeptics are now convinced that new methods can help them change the face of their land. Jordan's desert is the home of nomadic Bedouin tribes who live in tents and follow their roaming herds of camels and sheep. One of their first rules of conduct is hospitality. The drinking of bitter coffee is a ritual observed with every visitor. The Bedouins have changed but little since the early days of Islam. They are independent, proud, and distrustful of any but their own traditions. Many of these desert people have never seen a tree or a river. They know such wonders exist, only through the description of paradise in the Quran. Although it does rain in the desert, the only water the Bedouins have is what is collected in miserable stagnant water holes. Strangely enough, these desert people have been among the first to realize the opportunities offered by technical assistance. In the early days of the program, a tribal chief named Sheikh Ali asked American officials to help restore one of the old cisterns that had been built by the Romans when they occupied this region. These cisterns were reservoirs along the line of Roman trade routes, but they had long since filled with silt and held little water. Sheikh Ali's idea seemed sound and in accord with the program's principle of working with facilities already at hand. An agreement was reached whereby the cistern would be restored.